Most people don't know what the kidneys do anyway. I think when you find out that it's not going to be like that, that's when it's like a kick in the face. And you think to yourself, why me?
I was a bit scared. One of the reasons is because I had to get a fistula as well. And obviously people think, oh, another operation and stuff like that.
My wife said it's like going on a journey. And when it happens, that's the car crash, splat. And you don't know what's going on. You're injured, you're in pain, you don't know what's happened. And as you recover, there's all different roads you can take. And if you take the right road with the right support, you'll make it. But if you go the wrong way, or don't try or don't listen to what you're being told, you won't make it.
It's really important to raise the profile of what this project is, and that's about getting things right for our patients when they start dialysis to improve their life expectancy and make them well so they can lead normal lives.
The haemodialysis project delivers a bespoke treatment plan for each individual patient. So when they come to us, we can deliver quality of care because also the nursing staff know where that patient's treatment plan is, giving that patient confidence in the nursing staff. So they start with us feeling more secure in the environment.
Since the pathway has been adopted, we're able now to have everything there in a nice file as soon as the patient arrives on the ward. They've been seen in clinic, so they've got a dry weight prescribed, they've got the relevant drugs prescribed, they've got access that you know about, so everything is much easier.
Especially in my full-time job, you need a bit of energy because it's a very physical job. Because what I do is walk around for like 6-7 hours constantly. When I was on haemodialysis centre, you had to wait for transport, obviously. Then I'll get on the machine for 4 hours and then come off around 10-11. Then I'll have to wait for a taxi, which would get me home for like 12, nearly 1 o'clock sometimes. And then I'll have to be up at 4 o'clock in the morning, so I wasn't getting a lot of sleep and stuff. Home haemodialysis is a lot better because set the machine up, wait for my partner to come round to help me get on, and for 2 hours, 8 minutes, all done and dusted. So I've got the rest of the day to myself. To start with, I was a bit reluctant to have home hemo because what I've seen over the internet and stuff like that, it's a little bit scary and all stuff like that. But I've done PD before and I thought if I can do that, anyone can do, I can pretty much do anything.
Well, the first dialysis pathway project has affected us positively because within centre haemodialysis, he was doing it 3 times a week. He was more drained. We couldn't do stuff together. We couldn't go on days out really because he was just sleeping all the time. And with this one, I'm more directly involved, which I like. I like getting involved and like knowing that he's well. Even
though I'm sick, I don't look sick. Normally when you don't look sick, people may think, oh, he's slacking in work. A lot of people do say stuff like that. The dialysis pathway has been absolutely brilliant for me. I've got my life back. I can hold down a full-time job without getting too tired, too sickly as well.
We can decide, oh, we'll take this much off this day, we can take this much off that day, so we won't be as tired. We, go away together. The rest of the family think it's brilliant because Michael gets to spend more time with his mum, his brothers. We can go and visit my family for barbecues in the summer. He's got more energy to do that, whereas he didn't have energy with in-centre haemodialysis.
I can look forward to the future and I've got more respect as well, holding down a job. Appetite is a lot better, I'm putting on weight, and so yeah, it's been brilliant. I encourage everyone to at least have a go at it and then see for themselves. If it doesn't work, it doesn't work, but I can guarantee it will work for you.
There is an end to it, there is an end. So if you just bear with it and do what you're told and look after yourself, hopefully, God willing. I wouldn't be able to have a That's a fact. They're good. They don't mollycoddle you, and they'll tell you straight. If you're a nosy boy, they'll tell you, or they used to, not as much now, but years back they did. You didn't die. They said years back, if you don't dialyse, you'll die. And when you're 23-year-old and you've just been married and your whole life's ahead of you, you can't tell me that, but it's a fact. And the quicker you learn that, the quicker you're going to be okay.